Hey everybody, welcome to the TIMGA podcast. Today I'm joined with Dr. Jeanne Anyouzoa, and just so excited to have her on the show. Know her for a long time. We were one of the pioneers who started TIMGA together, and without her help, I don't think we would get to this place. So, Dr. Anyouzoa, welcome to the show. How are you doing?
I am doing great. Thank you for allowing me or giving me the opportunity to be here with you today to talk about the work that TIMGA is doing and most importantly, my journey as a foreign medical graduate here in the United States. Thank you.
You're welcome. You're welcome. And I'm just, I think your story specifically, Dr. Niozua, will, inspire people. Because a lot of times, we hear that, hey, if it's been some time since you practice medicine, there's no hope for you.
Mm,
You're gonna be filtered out, from the match process.
indeed.
And I think this kind of gives an opportunity. This alternative pathways, including the MDCE pathway to a lot of folks out there. But before we get into what you're doing right now, just talk about coming to the U.S. and trying to trying to like integrate into the U.S. healthcare system. How is that for you?
Well, I will say the journey has been long, difficult, but mostly humbling and restorative. It was a learning path. So as you might know, I've practiced medicine in Cameroon for a couple of years as a general practitioner before moving here in the US. So when I moved here, and of course I knew I wanted to still be a medical doctor, a physician, so I embarked on my IMG journey, studying for the USMLE exam and passing all of them, and you have to understand what's going on for a foreign graduate coming here you have to learn about a new system, and you have those barriers like studying for the USMLE. For me, for instance, the language barrier because I studied in French and I had to study in English, isolation, the financial pressure, and all of that. It was humbling, and it was transformative, which was great because as for all journey you have to find the things that keeps you moving
Yeah.
forward. And after doing all my steps, step 1, 2, and 3, I embark on the matching process, which unfortunately I did not match. And I think the the things that marked at that point, it was not about passing the exam or failing them. It was about deciding, knowing who I was
Yeah.
at that point to rebuild my identity. When you start on the process, you are going to be the doctor that you were born to be, to practice. And at some point, they say, no, you cannot. The system not cast you as I say, well, you are an old graduate. And instead of stopping there, I pivoted and I went to public health. So I earned a master in public health from the University of Washington, and I went into advocacy and diplomacy, working for organization to a coalition, a global coalition to help create a treaty to end violence against women and girls. So while I did not serve, as a medical doctor hands-on, I was still involved in some capacity in global health, in health, but at a systematic level. So, and doing that for a couple of 4 years, I still had the pull, to have that connections with patients. So I started my clinical reentry, and I enrolled in a master in clinical nutrition and integrative health. So
Nice.
that is what I am currently doing. And then the opportunity, and now I am with Altia, healthcare and acute, post-acute term, in a post-acute term position, which
Yeah,
of course I will give my thanks to TIMGA and the We Are Dogs
yeah, that's
organization.
amazing.
Mhm.
Yeah, yeah. And before we kind of dive into your, current role with Altia and the direct, your journey to working as a physician right now.
Mhm.
Um, so what would you say, Dr. Niozua, to somebody, let's say, who just arrived, maybe like, an immigrant has, kids, I know for women it's even harder, and they got multiple responsibilities as well as, let's say, they got to study, maybe like they got to help with income and they got to like work. So how can, like, how would you advise them, like, if they want to do like um this USMLE steps and still provide for their family as well, like what is like what should IMGs do in that situation?
Well, this is one of the things that you need to be prepared for that, because financially it's not cheap, to prepare for that. But it is something that you need to do, and you need to find a community of support, a system that will help you. You cannot do it by yourself. That is not possible. There are not, I won't say organization, there are groups. There are so many groups out there that you can reach out to and build your community around helping you. We will help you, you know, prepare for this exam and pass them. But most importantly, you need to stay involved in some capacity. Being able to practice medicine here in the United States as a foreign medical graduate is not straightforward, but you have to keep working, to stay involved in some capacity, in services, in advocacy, in coalition building, in communities.
Yeah,
That's, for me, is one of the most important. Avoid isolation.
yeah, yeah. That's amazing. And and how do, like, once you got the steps done and you were able to apply for the match, and you were practicing as a general practitioner for a long time, and you had the knowledge. It's not like the human body is different from one country to another, so and you prove your medical knowledge. So how did it feel, like, the system not kind of appreciating your work experience and looking only at your graduation?
Well, I think it's something that it's a new system for all of us, and I believe it's important for us when we come here to start to try to understand the system, because what we have when we study in our countries is very different from here. Yes, it's difficult, it's hard, it is complicated, but we need to understand where they are also coming from.
Yeah,
There are so many laws and restrictions and barriers here that if you are not allowed, if you do not understand them, your first job might be your last, because you will make so many mistakes because you do not understand the systems. Yes, it's a hurdle, but I believe it's necessary. And and thank God for the work that you do, that we did, in advocacy for a new pathway for physician like us to be able to serve, to practice. There are ways around the United States right now where they understand the need for doctors, because like when we started this work, this advocacy work, we realized that in 10, 20 years, the medical force will be low. So, and there was a news force out there of foreign medical graduates that were not doing anything. They were left on the sidelines, right? So doing this advocacy work has helped and will help, and people around the country are understanding right now that there's a workforce out there that they can use to serve communities here in the United States.
yeah, that's amazing. That's amazing. And for you, like, let's, once you said you did a master's of public health, and you also did, a master's in nutrition, right?
Yes,
Is that
I
right?
am currently doing completing my master in nutrition and integrative health. Yes.
Wow, that's amazing. That's amazing. And how are you able to, juggle all that, with, working with global health and your full-time job? Like, you seem like a very amazing person. I know you're an amazing person, but you seem like a superhero.
I will say my family. My family has been a constant support for me. I have an amazing husband and amazing children, who were all backing me up. We are a family of, okay, we are always having something to do when it comes to school, to working. But like I said earlier, you cannot do it by yourself. You need a community, you need partners, that will help you navigate the system and help you move forward and doing all that you need to do to advance.
That's amazing. That's amazing. And okay, right now, fast forwarding to your current job in Altea, tell me about it. Because a lot of IMGs, they want to, work in this alternative pathway.
Mhm.
Some of them, they want to know, hey, like, how can I get prepared,
Mhm.
to work in the U.S. healthcare system again? So tell me just about your current role. How was it? How was the interview process? How was, your orientation? Just, kind of, if you could talk a little bit about it.
Yes. Actually, my work at Altea Healthcare, it's a post-acute care system, you know, and I believe it's a good way to enter clinical again, after a while. It's a good place to start, and I started the interview process was pretty straightforward. We went through my credential, my experience, and everything. And most importantly, it was about how I felt. Did I feel that it was the right time for me to go back into practicing medicine? Did I feel confident that I would be able to do it, that I wanted to do it, after a while? And my answers to all those questions were yes, 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 and yes. So that's the most important thing. Do you feel that this is something that you want to do again? Yes. And the interview process, after the interview I had, and when I got the offer, I had to start working on the license, the MDCA license, and which is of course completely different from the full license. And it took a while because you have to to request your credentials from your school. You have to send your documentation to the commission to for graduation, yeah, to, I think, the credential to graduate your credentials, to verify, sorry, your credentials. So that will take a while, and it's somehow costly. So you also need to be prepared financially when you embark on this, because it goes by so fast. By the time you receive your license, you have to start work, you have to start your training, which also is straightforward, is hands-on. When I started 2 weeks ago, we had first an online training where everything was poured out. You do not panic, because this is something you are going to do for a long time. And I've met so amazing people at the facility I'm working currently, and they are so helpful. They understand where you are coming from, where you are going, what you need, and they are teaching you, showing you the process, because it's different from what I've done before, and they are amazing people. They are very helpful, and so far it's going great.
That's amazing. That's amazing. I'm excited that you're treating patients and taking care of patients again, and I do believe it is really great work. The post acute care space, because you are taking care of the most vulnerable
Indeed.
communities,
Mhm.
geriatric communities, and and most of them have like polypharmacy. They have like all these different type of stuff going on. They might get cellulitis, pneumonia, and it's just like it's an opportunity for you to kind of practice medicine, uh,
Great, great.
and and kind of see, like, I would say, a broad range of medicine. So do you, once you kind of like got in, and and you got the job, and I know you were in Massachusetts, you were in Boston, all right,
Mm-hmm.
and you were moving to Washington State again.
Washington. Mm-hmm.
So tell me, how did your family feel? Because I know they were supporting you for so long.
They are on board. You know, it's going to be hard on them, that's for sure.
Yeah. Did
Uh,
everybody move?
no, 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 not at all, not yet. Actually,
Okay.
I already have three kids in college,
Oh,
though they
nice.
were already out of the house.
That's good.
It was only my, I was almost an empty nester now. So for me, it was like, oh, I have my little one, he's 14, he's going high school next year, and he's with his father for the time being. So we do the back and forth. And so
That's
far, it's still good, but
good.
they might eventually move back to Washington
Yeah.
State because we lived here for a long time. So it will not be like they are going to come to a new or different environment. So you are
Yeah.
still working the details.
That's amazing. That's amazing. Tell me, how is the education process like? Because I've spoke with some other IMDs as well. It looks like they're liking, some of the constant education that they're getting. So tell me about, like, like the case discussions that you have, and some of the educations that you're receiving.
Well, it's when there, we have in the system that we are using, there are so many resource and course resource that you can go and study. You know, we have patients who are in for long-term care and some who
Yeah.
needs really skilled nursing care. You know,
Yeah.
maybe after a massive cerebrovascular accident, and we have to rehabilitate them,
Yeah.
you know, to be able to go back to almost what the life were before the accident. And this is, we have the help of, I would say, I have the help of the entire team. There's a communication that goes around team members, you know, from top to bottom. You know,
Yeah.
we all work together to make sure that the needs of the patient are met
That's amazing.
in a very cohesive and integrative way. You know, the a single patient will have at least 5 to 10 different care providers based on the different aspects, you know, that
Yeah.
it brings to his pathology. And this
Yeah.
is something, this is very, it's amazing because by the time you see, as a provider, you see the patient, there's already a lot of work that has been done for you to be able to care for him in a very effective way.
Yeah. Yeah. Wow, that's amazing. And you're doing great work, and taking care of, like, patients that really need it. I mean,
Indeed.
and I tell this to a lot of people, a lot of doctors. Without this program, there's actually, a lot of clinics who called me and they said, without this program, we would have turned down 4,000 patients a year.
Yeah.
So
Mm-hmm.
it's especially in rural areas, because I have a lot of of doctors working, like, in Yakima, and Sunnyside, and
Mm-hmm.
Spokane, and like really remote areas,
Yes.
and looks like basically they're yeah, the need is very high. The need is
It
very
is.
high.
Yes. Mhm.
Yeah.
Mhm.
Um, Dr. Anyouzoa, thank you so much for coming. Any last words before we go?
Yes, I would say for any IMGs, you know, it comes in, and the first thing I will say is to not, you know, define your worth by a residency acceptance, you know, and I said earlier, stay clinically or even professionally active in some capacity. And most importantly, build relationship. Opportunities often comes, through community, and be open to alternative pathway. Here I am, I was open to that, and here I'm practicing medicine again here in the United States. So,
Yeah, yeah. I like what you said there, which is, don't define your worth on the results of the match. And it's hard to, because sometimes, like, when you don't match, you kind of question yourself, hey, am I a
mhm,
doctor really? Why am I
mhm,
being left out? And
exactly.
you kind of get ashamed maybe of, being called yourself a doctor again.
Mhm,
It kind of, the whole process kind of is like it's a sort of a humiliation ritual, right? Because you have your entire you have your work experience. You have
mhm,
years of experience in your country. You have passed step 1, 2, and 3. You have done all the requirements. You provide a wealth of knowledge. For in your case, you have an MPH and you're doing a master's in nutrition, right?
yes.
And in a world where we need, like, less medicine. We need patients, more patient education, right?
Yes.
So you're doing great stuff, and we need more preventive education,
Yes.
preventive medical prevention, right? And you've bringing all this wealth of stuff, and somebody says, doesn't even look at your application. It is very hard to do that.
It
and
is.
um and you're right. Don't define yourself like that. And this is an alternative pathway for you to you know serve patients who really need it, because that's what I know a lot of ITPs, internationally trained physicians, who would work for free, honestly.
I know. I
So
know. We've
so
all been there,
yeah.
we've we did
Yeah,
that. Hmm.
yeah. Awesome, awesome. Dr. Jeanne Anyouzoa, everyone, physician at Altea Healthcare. Thank you so much for joining me on the show and talking about your experience. And I hope you can join me again in the future.
Thank you. Thank you so much, Dr. Khalif, and wonderful to see you again. Thank
Wonderful to see
you
you
for the
again.
opportunity. Thank you. Hmm.
Awesome, awesome. And we asked this for some people, but if other doctors want to get in touch with you, are you on LinkedIn? Like, what
Yes,
is?
I am. I am on LinkedIn. Yes, I have been receiving and accepting so many, LinkedIn invitation. I've been reaching out to many doctors from the community too. So yes, indeed. Mhm.
Awesome. So yeah, you can find Dr. Anyouzoa on LinkedIn, and we hope to see you guys next week.
Next, okay. Thank you, and bye bye. You have a wonderful day.
Thank you so much.